Hi, I'm Michelle Turner from Movement Lesson, and I'd like to talk to you about vision. Most people think that vision is a 20/20, 20/40 type thing. Do I need glasses? Do I don't need glasses? I look at vision for function. Now what that means is, how do my eyes function in my head? Cute little test you can do. Can you stand here, keep your head straight? Just go left to right with your eyes. Can you talk and do it? Now, can you look both ways? Starts getting more complex. Can I look to the right and move my head to the left? And vice versa. Kind of look like a hoot owl. There's lots of different things that the eyes can do. Now this is all based off of your horizon. Now for some of you now dealing with the munchkins, this is midline. Can my eyes cross midline? Can I turn my head through midline? Can I reach through midline? And that's a midline function. But one of the things with vision, not only do you want a nice smooth midline, and if you see, sometimes you might see like a skip, and that's where crossing midline for visual is becoming a little bit difficult. When you see that little, I call it like a hiccup. Another big thing for me is upper quadrant. You know, look, there's a bird, there's a plane, snow is falling. A lot of kids, when they have developmental delays or concerns, people don't notice that they don't work the room and how their eyes function in their heads. They're just assuming because they're delayed, everything's delayed. Well, yes and no. Vision can be worked with just as much as you can work with other functions. It's going to be overlooked though much more. You should always have your kid assessed visually, I would say by a year old. I don't care if they're healthy or not, because an ophthalmologist can see things in a child. And again, I'm saying ophthalmologist. It's great that your child was looked at by the school system. Go to an ophthalmologist. You know, that's just, they're looking for functional vision as well as the 20/20 stuff. My son grew up with the experience of cortical visual impairment. So that's my experience starting out at Foundation for Blind Children with him in preschool there. He does much better actually in the back of the room because he's better at social cues, getting papers and pens out and stuff. When he's up front, he's not seeing what the other kids are doing. So he's not picking up the cues as much because he doesn't work the room. Why doesn't he work the room? Because again, habitually, if you have CVI or another trauma to your system, then again, you're not working the room, so you learn those habits. Sometimes with my son, you could think he's complete la-la land. He's sucking it all in, but he's learned he doesn't have to visually look at you to learn something. And that's fine. He's getting straight A's, what do I care? However, you know, he does karate and all those other things now, so I've worked with him visually through the years. But you can still see those habits that pick up. Now the ring that I'm using, it's just a ring. It's really obnoxious. I probably wouldn't do what I'm about to show you with this kind of light, especially if your child possibly has seizures, but I'm doing this because I have my lights on and this is just easier to see with the videos. What you can really easily do with your child, and you can do this with an infant as well as a 10-year-old, it's okay. And just look to see how they follow the light. Now, are you having to instruct the child? No, keep your eyes on it, keep your eyes on it. Well, that's going to be a clue that, again, when you're seeing a light, you're kind of drawn to that kind of, your eyes want to work. So a solid light would probably be better. And again, you don't want to poke a flashlight in a child's eye either. You're just looking for just a light stick or something. But even a sticker will do. Like if they like Dora, use a Dora sticker. So, and just see how they follow. And now another thing you want to do is you want to just do this up and down. Are any of these difficult? A lot of children you might see getting to here and then the eyes fall back down again where they can't track up. Or where I start getting concerned as a movement person is, do they suddenly shorten their head? Because I can't hold I'm looking up here, I can't hold my head. Or does the back round, or those kind of, where the back kind of collapses in this kind of position versus being able to, let's say, extend the head up and look on the spine. Now notice too where I'm holding it in my sight. I'm not here. Notice how as I get here, I get more of a cross-eyed kind of thing going. And you want to, especially with the babies where the muscles aren't as used to focusing, they will go cross-eyed quite easy. So you want to keep it, and again, notice that I'm going at a slow, I'm not going here, look at the light. And then if all of those are going great, and if they're not, then that's something you can work on. This is something you can do at the dinner table. You know, follow the French fry, follow the French fry. Oh, here it comes, you know, that kind of thing. Just little things during the day to strengthen your visual muscles. But another thing to do is convergence. And you bring the item in quite slow. And you're looking to see, do the eyes actually cross? You want that crossing to happen because they're following the object. Where there is a problem, let's see if I can do it. I'm going to try and bring my right eye into the object and keep the left eye out. So see, sorry, it's a little hard to look and talk at the same time. I don't know if I can do it with the other eye. Let's see. So see how my left eye wants to do it a bit more than the right? I don't know. So that would be considered like a lazy eye or something like that. That's where something you definitely want to see the ophthalmologist if you see the eyes not working in tandem, even if it's just here and there, like when the child's tired. Great, when you're tired, so your muscles tired, so your eyes can be tired. So if you're seeing where the eye goes in or out, where the left eye is separate from the right, there might be a need for glasses, but also patching might be an option. Patching is something that your doctor has to discuss with you, and what it would do is you would randomly patch, but mostly you go over, let's say, the good eye, so that the weaker eye is meant to work a little bit harder and bring that back into focus. You rarely hear stories about people actually where their eyes shut down for that reason. When the eye is not working in tandem, the weaker eye can actually just fade away, and the brain won't recognize the eye anymore. So you want to get that kind of attention much earlier as for an infant. But those kind of things can still show up till they're even 4 or 5, depending on the child. So you really want that taken care of. And those are just some little things that you can do visually. To get more complex, what about a cross, where something's at an angle? Now this is crawling. When you're working in crawling, as I'm working with crawling, my eyes are heads going to and fro. And if the child hasn't crawled, these are some of the visual references that didn't get organized as strongly as they should have had the child crawled. So those are just some things that you can work on using your lights. I get all my stuff from Flashy Blinky Lights. I love that site. But again, I wouldn't go with something this bright. Light stick. What's again neat about the light is that the eye wants to be attracted to the light. And so those are some little tricks that you can do with your child. You can do this in the bathtub. You know, you can do this. It doesn't have to be sit down, we're going to look at this. But any concerns, see a therapist, but especially with the eyes, see an ophthalmologist, because there's nothing better than working on your kid's eyes. Thanks.